HealthWorks, the CDC recommends antiviral medications like Paxlovid to treat COVID-19, but a new study shows that most people are not taking it. Some weren't even offered it. Fox Medical team reporter Beth Galvin joins us live to talk more about this. Hi, Beth. Thanks for being here.
Thank you for having me. Good morning.
Well, we understand some people weren't even offered the medication, including some high-risk veterans at a hospital in Boston. Have you heard about that, and what have you found out about it, if so?
Yeah, so in this study, researchers looked at the medical records, and I think this was from 2022, the medical records of veterans at a VA hospital in the Boston area who came in and tested positive for COVID-19 infections. And they found that, 20% of the time, the veterans declined to take an antiviral. So they were offered, but they said they didn't want one. But 80% of the time, when they looked at the medical records, these veterans who some of them had kidney transplants, all of them were considered immunosuppressed or immunocompromised. 80% were never offered an antiviral, and they looked at the reasons why they didn't, the doctors didn't offer the antiviral. And what they found, Melissa, is the most common reason was their symptoms were mild. Other reasons, they didn't prescribe it. They weren't in that 5-day window when you need to start the medication within the first 5 days of developing symptoms. They also maybe lacked COVID-19 symptoms, or in some cases, the doctors were concerned about an interaction between a drug that the veteran was taking and how it would interact with Paxlovid or another antiviral like that. But what stuck out, Melissa, is the fact that, 8 out of 10 not offered the medication, and often they fit sort of the guidelines for getting the medication. There's somebody who's at risk of getting really sick, and there's somebody who's, has mild to moderate symptoms, so might benefit from this medication.
And Beth, what's so confusing about it is a lot of doctors say the antivirals are designed to be used for mild COVID-19, but yet the doctors weren't prescribing them because the patients had mild symptoms. So what gives?
Well, I think that there's some confusion, maybe on the part of doctors and maybe on the part of patients too, with the doctors not being clear that, the CDC recommends this for people who have mild to moderate COVID, who have tested positive, who are at high risk, but they're not really sick enough to become, to end up in the hospital. The drugs are designed to keep you from getting sick enough, severely ill enough to need to be hospitalized, to get into that danger zone where your complications can be life-threatening. So it's designed for, patients who are at higher risk but have these mild to moderate symptoms. And I think, maybe at the time, doctors weren't completely understanding, the guidelines as well.
Well, I certainly feel like conversations like this between us, Beth, are an awareness campaign where both patients and doctors can look more into it and just make sure that they're doing the right thing for them. Thank you so much for your time today.
Yeah. Thank you, Melissa.